If you have a healthcare spending account like an FSA through your employer, as well as healthcare that you're paying for, there are some details I just learned that you also need to know. If you already know this, cool. If you don't, I just had to learn an expensive lesson because of it. So, when you are navigating those two different pieces of the puzzle when it comes to your health, you need to be in charge of being on top of every single part. So, story time. Go to my dentist, who is approved through my healthcare, through my health insurance, of which I use my FSA card when I pay for my portion at his office. It does not, once that dentist or doctor, whoever you're going to, gives you a referral to another person, another party for some other work that they don't want to do on you or they can't do on you, you need to check them too to make sure that the insurance covers that as well, because they could be referring you to someone that's completely out of your network. You know that, like, in network, out of network, they could be referring you to someone completely out of your network without their knowledge, I guess, because I would think if one's in your network, they're going to refer you to someone else in your network. No, they're not. That's on you to figure out and make sure that it's all going to pan out correctly, because I just found out the hard way and I just had to pay, what was it? $1,630 that I thought 80% of it was going to be covered because of my health insurance that I pay for through my job. Nope. Since I didn't check with B doctor that A referred me to ensure that my insurance was going to be covering the 80% like it does at Dr. A, now Dr. B is saying I'm out of network. But now Dr. A wants certain things. Ooh, they're calling me back. Give me a second. Nah, that was that automated thing trying to get me to give a review. You don't want my review right now. You don't want my review right now because my review is garbage. It's garbage because, it's like I can't get too mad at the dentist and I can't get too mad at the other dentist because they're just doing their jobs. And I'm sure it's freaking frustrating on their ends having to tell people this bad news or having to navigate all this chessboard of healthcare that they have us all within. So, back to the story. Or I shouldn't say story. The lesson. The lesson here is you have to do your homework. And you can't trust your doctor, your dentist. You can't trust any of them to be doing the homework for you. They only do the homework for themselves. So when they refer you, ensure that they're referring you to someone that's in your network. Because once they have referred you to someone out of their network, it's on you. You're footing the bill, or you're using your FSA. Thankful I put that aside, because if I didn't have that FSA, that would have been coming straight out of my bank account or whatever, credit card, whatever have you. But now, what's even like crazier about this is like, I'm expected to go back to Dr. A to get a crown. This is all for a crown root canal situation. And now I'm expected to go back to Dr. A to get this root canal. And I'm going to try my best to be as like I told you, I understand he's just doing his job, doing his homework for himself or his own building. But part of me wants to go, why the hell would you refer me to somebody that's not in my health, that my health insurance isn't covered? Maybe he knew that, because there was this one point where he was like being really vigilant about saying how I pay on my FSA and make sure I have enough and don't get both root canals done that I need and just get the one done, and then, or see how much the one is going to cost before paying for two. Bro, why didn't you just say your health insurance isn't going to work at this place I'm referring to you to? And if you did, I missed that part. I am humble enough to say, hey dog, I might have missed that part. And this is why I'm making this video. Don't miss that part. Ask questions, get the exact information, because it's chess. It's really chess. You have this FSA account that you're giving part of your paycheck to put money aside to pay for your healthcare expenses. Then you got your health insurance that you're paying for to try to minimize said expenses. And if you're not paying attention, it's not minimizing shit. It's, if anything, it's it's kind of minimizing it, because it's like the FSA, if you're taking it out of your pay, it's like pre-tax dollars. So you're kind of minimizing it, but still, I've been dealing with this since May 26th, And I can't say I've been dealing with it since May 26th. May 26th is when I thought I did something cool. I did something good with my money. I spent it smart. And then now I'm at July 6th thinking, damn, I did not ask all the right questions. I'm out this money, and now part of this crown that I'm paying for in August, I might even skip my next appointment because I ain't got to hold off. They want to do a checkup appointment for a cleaning and da. And I'm like, and I didn't even know this appointment was even like scheduled, but now we have this appointment coming up in a couple days, and I'm like, do I really want to go do that? Because now I'm gonna have less money for you from an FSA because I'm about to clear that all the way out for this crown. All the way out. Sorry for the long video, but I think it's required at this point, especially if you're like me, contributing large amounts of money from your payroll, your paycheck to these systems, this chess system, thinking it's gonna do a certain thing, and if you don't ask the right questions, it's not. And so now the money is gone. And mind you, FSAs have to be used by the end of the year. It's going to be used for me at least at the end of the year. But, well, story time over. If you have any questions, I am happy to try to answer them as best as possible. But as I've said, I'm learning a lesson, and I'm sharing that lesson. And yeah. Yep.